Health Talk brought to you by Rapides Regional Medical Center. It's a diagnosis many have never heard of, but it kills more than 210,000 Americans each year. That's why Rapides Regional Medical Center wants to make sure you know the signs and symptoms of sepsis.
Sepsis is the body's response to an overwhelming infection. Essentially, the infection becomes so severe that your heart rate rises, your respiratory rate rises, you can begin to experience organ failure, difficulty breathing, low blood pressure, and even death.
When treating sepsis, early recognition is key.
Sepsis is an infectious process, so oftentimes it starts with fever, chills, sometimes cough or congestion, difficulty breathing. One of the big indicators that an infection is becoming severe are mental status changes, excessive sleepiness, irritability, confusion. If a family member begins to express any of these in the setting of fever, that is a red flag that they need care promptly.
The symptoms can be very subtle, but if body temperature rises above 101 or in elderly patients drops below 96.8, if heart rate is higher than 90 beats a minute and respiratory rate is higher than 20 breaths a minute, it's time to get medical help.
Early recognition and early initiation of treatment with IV fluids and IV antibiotics are the keys to survival. As many as 25% of patients with sepsis will die. When you become septic, your likelihood of dying is significantly higher than if you were having a heart attack or a stroke.
For more information about sepsis and how to recognize its signs and symptoms, visit rapidesregional.com.